Okay, we are in our featured presentation. We have with us Dr. Brett Shannon. He is an occupational health doctor from Australia, where he has undertaken occupational and environmental medicine work with clients in mining, construction, agriculture, and aviation industries. He has completed his PhD on Indigenous occupational health with the University of Illinois Chicago and holds an academic position at the University of Illinois Chicago. Dr. Brett is an Australian Indigenous descent of the Ngugi people from Quandamooka country. He is the past chair of the Brisbane Aboriginal and Torres Strait Islander Community Health Services, where he was a director for 9 years. Dr. Brett has a specific interest in Indigenous health and the impact of excess morbidity and mortality, along with the disparities in social and economic indicators that contribute towards much lower workforce participation rates. Without further ado, Dr. Brett, it's all yours.
Thank you so much for the introduction. Really happy to be here this morning, and obviously it's an important topic on heat-related injury and illness, particularly this week. It should be the front of our minds. Before I jump into the talk, I just want to acknowledge the traditional owners of Chicago and Illinois, the Miami 3 Fire Peoples, and pay respect to their elders, both past and present. Chicago is where I currently live and work, and despite what people think, Illinois actually is home to a very diverse Native community of more than 75,000 tribal citizens, many of whom live in the Chicago area. So I think we need to pay respect to the Native citizens in our state. In this talk, I'm just going to present a lot of information and a lot of statistics over the next sort of 45 minutes, but I really wanted to start the talk with acknowledging that behind all this information are real people trying to make a living in roles as farm workers. Here, the Milwaukee Journal reports on Yuan Pina, who works in Iowa and Texas. He's actually on the left side of the tray of the vehicle in the picture on this slide. And he is a seasonal farm worker here, working originally from overseas, stating he works around 70 hours per week. What's interesting in this article is he states that he's actually had bosses here who, if they see you resting for a few minutes under a tree, he says, to recover yourself, they think you're wasting your time and they send you home without pay. And he said he's had friends and others who have been dismissed for doing the same thing. So I think in today's talk, we can discuss some of the best practice in heat-related illness prevention, but I want to continually highlight through the talk that challenges faced in progressing some of these changes in the health and safety in farm workers are very, very challenging for several reasons, and this is just one example. Farm workers are a very unique occupational group for us to talk about. They're especially vulnerable to heat stress due to a number of reasons, including the strenuous nature of their work, that their work is being performed primarily outdoors, they have a high workload, and they have a long duration of work. Like Yuan said, 70 hours of work per week is a very high workload. And like he also pointed out in that article, they're really induced to work under duress. They're often paid by piece rate, they have low job decision latitude, and they have a poor safety climate. And on top of this, there's a paucity of regulations and enforcements of any regulations, which really compounds some of these issues, as we have no federal OSHA heat standard, and only a few states in the United States actually have one. So it's just an introduction. Today I'm going to break the talk up into 3 areas. We're going to talk about climate and specifically changes in Illinois and the impact these changes are going to have on farm workers currently and in the future. Then we're going to talk about the different types of heat-related illness. And lastly, we're going to discuss some epidemiology and some prevention of heat-related illness as well. So let's start with talking about climate change because it's so important right now. It's interesting to note that 19 out of the last 20 warmest years on record have occurred since the year 2000. So we're really seeing it right currently now in climate change. By the end of this century that we're in, it's expected that 1.2 billion people worldwide are expected to be affected by heat stress, which is actually 4 times the number of people that are currently affected by extreme heat worldwide. And we know that as these numbers increase, compared to the general public, working populations including farm workers and outdoor workers, are going to be a lot more susceptible to heat stress. So they're a very important group going forward. Here, I just wanted to highlight that you can see the United States has not been left out in increases in extreme heat events. You can see on this map that if we focus on Illinois for a second, the southern and central regions of Illinois appear to have had greater increases than the rest of the state. And from other research on top of this, we also know that many cities in the Midwest and in the East Coast, including St. Louis, Philadelphia, Chicago, and Cincinnati, have suffered large increases in death rates during extreme heat events and heat waves. But what's important that I wanted to highlight as well is that extreme heat events, we don't just see deaths in the hospital from heat-related illnesses and injuries and heat stroke, but we also see increases in the number of deaths from heart disease, respiratory disease, stroke, and kidney disease. And we also see increases in hospital admissions for all these conditions as well during heat waves, not just deaths alone. Following on from that slide, here we are looking at the average temperature change in the United States, not extreme heat events. So we're looking at the average temperature change over the last century. And if you look at the top right of this slide, you can see the average change in Fahrenheit in the United States and the upward trend really since the 1980s. It's really gone off. And you can also see next to that, the changes in the Midwest region, which is very similar to the US average. We've actually seen one of the largest increases in recent decades in the Midwest compared to the rest of the United States. So what does all this mean regarding climate change? And I think it's really important to highlight that we really need to broaden our thinking of what the impacts of this are going to be on farm workers. Yes, we're going to have increased heat waves, and we're going to have increased temperatures, and we're going to have increased heat-related illness, but this also comes with other issues. We're going to have increased air pollutants, which may impact chemical exposure for farm workers. It may impact respiratory disease in farm workers. We're also going to have increased UV radiation. One of the biggest clinics I do in Australia is for skin cancer checks for outdoor workers. And it's very likely that we're going to see more skin cancer. We're going to have extreme weather events, and with that typically comes an increase in vector-borne and zoonotic disease, which may impact farm workers in the future as well. And in summary, I just wanted to share, I actually extracted the last 50 years of national weather data and had a couple of points to highlight. 2022 was actually the third warmest summer on record for the United States. And if anything, we can feel it this week, how warm it is. And we can see if maybe this summer is going to be even warmer than 2022. But then I focused on Illinois with the weather data and looked at the past decade compared to the previous 4 decades. And actually found that we've had a 4% increase in summer days with max temperatures over 76 Fahrenheit. And you might think 76 Fahrenheit, that doesn't sound very hot. But from a previous study that was actually done in Illinois, 76 Fahrenheit was the temperature that we actually saw an increase in hospital admissions related to heat. So we're actually seeing an increase in heat-related illness at much lower temperatures than many people think. And I just wanted to share this last slide on the climate, that when we compare extreme heat to other weather conditions and we examine fatalities nationally, here in the US in 2021 data, we can see that extreme heat is by far the highest cause of fatalities. And I just wanted to summarize this little section of the talk on climate and really just say that we're going to see more sporadic temperatures, we're going to see more extreme temperatures, and we're going to see a gradual increase in average temperatures. And all of these things are going to have impacts on farm workers. They're going to increase the risk of heat-related illness, and they're going to increase the other risks that I discussed previously as well. So that's all I wanted to share on climate, because we want to talk about heat-related illness for this talk. And I'm going to jump into that right now. So when you talk about heat-related illness, there's really a spectrum of heat-related illnesses to talk about. And I just wanted to pull this back a second before I discuss each of these and just share that studies suggest that when we're doing intense physical activity like farm workers are doing, for every 1% of body mass lost from dehydration, there's about an increase in core body temperature of about 0.5 Fahrenheit in temperature. And not only does our core body temperature rise when we lose every % of body mass from sweat, but we become dehydrated. We sweat, we lose plasma volume, we lose electrolytes, and then we have this spectrum of disorders on this slide here because of those physiological changes. And why is this really important, and why am I saying this? I'm saying this because it's really important to note that while the human body is remarkably resilient against cold, we're actually really bad at tolerating any minor temperature changes related to heat. Any temperature changes, for example, like I said, 1% of body mass loss equals about a half a Fahrenheit in core body temperature rise. If you get to about 8 or 9 Fahrenheit temperature rise in your core body temperature, that's when your body starts getting systemic dysfunction, really, and you'll see the heat stroke, you'll see multi-organ failure, and even death. So we're actually not that resilient to heat as we think we are, and that's why you see some of these disorders at much lower temperatures. And I think that's really important to note. But now I'll go through each of these illnesses individually, and we'll start with some of the more mild ones. So I wanted to start with talking about sweat rash. We don't usually talk about this too much when we talk about heat-related illness, but I think it's important because it actually impacts a lot of people. So this is sweat rash or prickly heat rash. Heat rash is essentially skin irritation caused by excessive sweating. So we know farm workers sweat a lot in the field. They have to wear heavy overalls and they can get excessive moisture. And this rash is actually caused because their sweat obstructs their sweat ducts and it forms itchy and painful red pimples and blister clusters and sometimes can lead to skin lesions as well. It's common around the neck, the chest, the groin, the armpits, the elbow creases, and even behind the knees for workers as well. The good thing about heat rash is essentially it's a self-limiting illness. However, it's really not going to improve until you dry the skin. Sometimes when workers come in with this, I tell them at nighttime you can remove some of that skin debris with a rough cloth in the shower. That can be really effective at opening up those sweat glands again before you return to work the next day. Rarely this condition can become infected, but if it persists and you do get signs of infection, it's really important to seek medical review. So that's the first of the heat-related illnesses. The second is heat cramps. So heat cramps are actually muscle contractions, usually in the legs, that are really forceful and painful. And there's a number of factors that are thought to contribute to these cramps. Things like dehydration, loss of sodium and potassium, our electrolytes, extreme environmental conditions, and fatigue are all thought to play a bit of a role in heat cramps. The other important thing to note is heat cramps can actually be a warning sign for heat exhaustion. And factors that might predispose workers to heat cramps include really high concentrations of salt in their sweat, insufficient salt intake prior to work, and a lack of acclimatization to work, and a really high fatigue level prior to starting work. Again, heat cramps, like heat rash, is a self-limiting illness. My advice would be if a worker is having heat cramps, to rest them in a shady, cool area, make them drink water or any other cool beverages, wait a few hours before allowing them to return to strenuous work, and if they don't go away, please seek medical review. The next illness I wanted to talk about was heat syncope. And like heat cramps, heat syncope is a really interesting condition. It's really a misnomer, as heat doesn't really directly cause the syncopal event. So heat syncope is when a worker collapses on the job. And you might think this collapse is due to heat, but the actual mechanism for a worker collapsing in heat syncope is you get an abrupt decrease in the venous return. So the blood vessels that return the blood to the heart are very dilated when a worker is working. And when they're working, their muscles are all contracting, particularly in their lower limbs. So the pressure of their muscles contracting actually maintains that blood flow to the heart because those vessels are so dilated. When a worker stops working to take a break or stops working at the end of the day, you stop having that pressure on your muscles, particularly in your lower limbs. And because those blood vessels returning blood to the heart are so dilated and there's no pressure on them because you're not using your muscles anymore, you get a very quick sudden drop in your blood pressure, and a quick drop in your postural tone, a quick drop in return of blood to the heart, which leads to a worker collapsing. So with this condition, I think it's important to note that workers' core temperature is actually either normal or only marginally elevated. So it's not caused by the worker having a very high core body temperature. The collapse and the loss of consciousness and the altered mental state typically quickly resolves with this condition. So workers typically return back to normal within 15, 20 minutes. And this is how we sort of help distinguish heat syncope from the next two conditions I'm going to talk about. So the next condition we're going to talk about is heat exhaustion. So heat exhaustion is an illness where the signs and symptoms can range from being very obvious in workers to very, very subtle. Unlike heat syncope, the condition we just talked about, heat exhaustion is actually related to core body temperature. It's the point where your body cannot maintain your core body temperature and you begin to have a fever along with other symptoms. It's important to note that this condition, symptoms can start at different temperatures, different times of the day, and different workloads for different workers. There's no set criteria and it's going to depend on the different risk factors for each worker. Typically, you'll see workers present with this condition with profuse, sweaty, flushed, clammy skin. They might feel lightheaded, faint, or have a throbbing headache, or they might have nausea and vomiting or ongoing muscle cramps. I think it's really important to note with this condition, I had one case in Australia. I didn't treat this case personally, but they presented with just nausea. Was their only symptom, feeling a bit unwell, and couldn't eat. And that was their only symptom. And this worker ended up dying actually because he wasn't treated appropriately. So I think it's really important for heat exhaustion for everyone to just think about the symptoms can be very, very subtle. And if it doesn't make sense, think about heat exhaustion, ask the worker, go through these symptoms, because it might just be heat exhaustion when it's a little bit of nausea or not eating or something very subtle. What do you do for heat exhaustion? Well, the treatment for heat exhaustion is really just to get your worker's body temperature down as fast as possible. Ideally, I know this is not what we can do in a lot of cases, but we try to get them into air conditioning or under shade. We have them lie down with their feet elevated. We apply towels dipped in ice water or water to under their arms, around their neck, to certain parts of their body. We have them drink up to around 2 liters of water over a 1 hour period, but not significantly more than that over 1 hour. If they don't improve or they seem to worsen after 30 minutes, you really need to seek medical attention. The line between heat exhaustion and the next condition, heat stroke, can be really fuzzy in some cases. So if the situation worsens quickly or you're unsure, don't risk it. It's always best to call for medical help. And the final condition we're going to talk about is the worst. So heat stroke is the worst condition of the heat-related illnesses. This is really a multi-system illness where your body just essentially starts failing. But what's important about this condition for you to remember is you'll start seeing central nervous system dysfunction. So this comes in the form of the worker will appear confused. They might have loss of consciousness. They might have seizures. And what's different to heat exhaustion is where I said they'll have profuse sweating and heat exhaustion. For heat stroke, they'll actually have red, hot, dry skin. They're typically hyperventilating. And what we need to do in these situations, again, like heat exhaustion, is rapid cooling. Rapid cooling is the most effective strategy for minimizing morbidity and mortality in these workers. It needs to be started as soon as possible and really within 30 minutes of these symptoms occurring. So what we tell workers and employers to do in these situations is if ice water immersion is not feasible or possible, we need to rapidly initiate any form of cooling. We need to remove all their equipment and their excessive clothing. Cooling should not be delayed in order to remove the clothing, so you try and do them both at the same time. And another point to note is people get hung up on getting workers' temperatures, but in heat stroke, rectal temperature is the only valid method. So any other form of checking a worker's temperature is really invalid and not really going to help. So what we say is ice water immersion is ideal, but any form of cooling that you can. And in the work setting, we say cool until the patient begins to shiver or the worker begins to shiver. Treat with cold water immersion for about 15 to 20 minutes. And this would cool workers by about 5 to 7 degrees Fahrenheit, which would be enough in most cases. And I'll just go back. I think this is all I'm going to say about the heat-related illnesses. I think this is a good introduction to each of them. Obviously, there's a lot more information, and the thresholds for these disorders are going to vary and be very different for everyone based on their own personal circumstances. So I'd say the most important thing to remember, if you take anything away from this section of the talk, is awareness of the symptoms and proceeding with caution when workers have very vague, generalized symptoms of feeling unwell. Think about heat-related illness when there's vague symptoms. So now I'm going to move on to the next part of the talk. It's really about how bad is heat-related illness. Let's talk about some of the current data, and let's talk about some of the prevention methods that people are using. So first thing I wanted to say in this part of the talk is, I think, why do heat-related deaths still occur in farm workers? And you only have to read the summary of this very recent death that occurred in North Carolina to understand the key issues going on. Here, a farm worker died in North Carolina where the farm only scheduled 1 5-minute break for the 6-hour day. Shaded or cool areas were not provided during those breaks, and the workers had to go into a bus that had no air conditioning and was often parked in a field with direct sunlight. They had a 10-gallon cooler for workers to drink, but there was no cups, and employees had to place their head under the spigot to drink. And there was no protocol for administering first aid or calling emergency responders for workers with signs of heat-related illness. And all these issues increase morbidity and mortality of any of these conditions we just talked about. I've gone over many heat-related death investigations here and overseas, and these are some of the frequent patterns and the frequent things we see in the legal cases. Colleagues nearby consistently fail to recognize the signs of heat-related illness. Workers working alone fail to recognize the symptoms themselves or call for help. There's a real lack of coordination between employers, employees, and other parties responsible for workers' safety. Typically, there's no systems to identify when a worker is actually suffering a heat-related illness. And again, there's no scheduled work to avoid the hottest times of the day or the season of the year, which is obviously really important as well. Unfortunately, the occurrence of these deaths in outdoor workers is far, far too common still, and cases like that one that I just shared with you are occurring very often. This map on the left-hand side of this slide shows the locations of outdoor workers who had heat-related deaths between the years of 2008 and 2014. It's not an exhaustive list because it only includes those cases that involve workers who are covered by either the federal OSHA or the state OSHA plan. And this is an interactive map on CDC if you want to look at it. You can click on the blue dots and it tells you what the worker was doing. And majority of them are very similar to the case we just heard about. The figures on the right-hand side of this slide are the deaths overall related to heat exposure per annum in the US, with about 702 heat-related deaths per year still. Of those 702 heat-related deaths, 70% are males, and 287 per year actually have heat as a contributing cause to death, but not actually the actual cause of underlying cause of death. So the actual cause of death in those 287 cases, we found that ischemic heart disease was the cause of death in a third of them. High blood pressure was a cause of 10% of them. and drug and alcohol poisoning was a cause in nearly 20% of those cases. The next thing I wanted to share with you in today's talk is around the heat index. So many of you have probably seen this chart on the left-hand side of this slide that categorizes by color coding how much caution should be given relative to the current temperature and the relative humidity. But I wanted to make 3 points about this heat index. The first I wanted to make is about humidity. We often talk about air temperature, but we don't talk about humidity and the importance of humidity. For those that are unfamiliar, relative humidity is a measure of the amount of moisture in the air. So sweat doesn't evaporate as quick when the air is really moist. And since evaporation of sweat from the skin is one of the ways we actually cool ourselves, when it's really high humidity, our actual natural cooling mechanism from sweating is reduced and we feel a lot hotter. So we don't like it when there's very high humidity, but I think it's also worth noting we don't like it when it's very low humidity either. So low humidity can be a problem for outdoor workers in like hot desert-like climates, because in low humidity, our sweat evaporates very quickly, which can lead to severe dehydration. So we need to think about humidity as well. The other point I wanted to note about the heat index is it was actually originally developed for shady light wind conditions. So it wasn't developed for outdoor conditions working in the sun. And they actually note that if you are working in the sun, you can actually increase the heat index values by up to about 15 degrees Fahrenheit. So it can actually be a misconception if you just go by the heat index for farm workers. The last thing I wanted to point out about the heat index is from a study done from 2014 to 2016, I actually highlight on the right-hand side of this slide when worker deaths occurred related to the heat index. And you can see it's not just in extreme danger temperatures based on the heat index. Only 1% was in extreme danger, 27% in dangerous heat index categories. And actually the majority of cases occur in cautious or extreme caution temperature and humidity values based on the heat index. So I think it's really important because it just shows us that we need to be cautious at all levels. Just because it's yellow on the heat index doesn't mean that we don't need to be cautious about a worker dying. Following on from that slide, I just wanted to share some results from another study. This study shown here makes this point about they analyzed worker heat-related deaths recorded between 2010 and 2020, and they compared each death's day's highest temperature with the historical average highest temperature over the last 40 years. So from this graph, I just wanted to share really 2 points. You can see that most of the deaths happened on days that were unusually hot for that date, and more than 2/3 occurred on days when the temperature reached at least 90 degrees Fahrenheit. So here you can see only a few, if you look at the maroon, the dark red, only a few occurred where the temperature was much higher than the average. And majority occurred when the temperature was only slightly higher than the historical average for where the worker was working at about 0 to 10 Fahrenheit. I wanted to share some statistics here about when new workers are most vulnerable to heat-related deaths, because I think this is a really important topic. We know that new and returning workers, there's more strain on their vital organs, their sweating reduces, and they have various other physiological mechanisms that make them more susceptible to heat-related illness. And a couple of recent studies done in the United States looking at samples of heat-related deaths really showed this, how stark the numbers were. So one study from 2014 showed that 50% of heat-related deaths occurred on a worker's first day on the job. And another study showed that 70% occurred on a worker's first week on the job. And we know that if we look at the NIOSH guidelines, Typically, acclimatization takes 7 to 14 days of working. They recommend a 20, 40, 60, 80% workload for the first 4 days of new workers starting a new job and never doing farm working before. And they also recommend 50, 60, 80, and 100% workload for the first 4 days of seasonal workers returning to work who have had previous experience on the job. We know this isn't the case in most instances, and from the deaths that I've seen reported, a lot of these deaths are occurring in young workers who are not acclimatized, but they're just not used to how strenuous these jobs are. Young workers are also not as likely to ask for help when they're struggling, and they usually won't share the symptoms they're having with their colleagues as well. Now I just wanted to share some of the statistics around the demographics of migrant and seasonal farm workers, because I think it's really important to understand what demographic of workers we're talking about and not just treat them as a homogenous group, because we know not just heat-related illness, but any injuries and illnesses related to work, there's going to be different risk factors based on age, based on sex, and based on a number of other conditions with the workers. So in terms of hired migrant and seasonal farm workers, there's around 2.5 million in the United States. We have 55,000 in Illinois, 80% in crops and 20% in livestock. About a quarter are women and the rest are men. The average age is in their 40s. Majority are foreign-born and Spanish-speaking, and 50% lack legal status or work authorization. 80% have settled in the United States. 10% travel greater than 75 miles for work. 5 to 10% follow the crop from south to north, and 3 to 10% cross the US border to work. And I really just wanted to share those demographics and then just talk about farm workers for a minute, because I think farm workers really have the trifecta for underreporting heat-related injuries and illnesses related to a number of things on those previous slides. In terms of regulations and regulation exemptions, like I said earlier in this talk, there is no standard. OSHA endorses a clear set of heat stress prevention, including allowing new workers to acclimatize, providing hydration, rest, and shade, training workers and supervisors. But we really need more. This is not good enough anymore. We need a standard, and we actually need enforcement of a standard as well. Many workers are employed temporarily, like I mentioned, so the nature of employment here really exacerbates heat illness. When employers pay farm workers based on piece rate, like Yuan pointed out in that article at the start of the talk, the workers earn according to how much they harvest, and this really disincentivizes taking breaks to rest, seeking shade, or drinking water. And this precarious employment also limits reporting of heat-related injuries and illnesses through current systems such as workers' compensation. And thirdly, language and cultural barriers. Here I just wanted to mention that we have a really transient workforce, majority working away from home in a new environment, which brings about another set of barriers that can impede identification of illnesses and administrative controls such as appropriate training and education. I know I've shared a lot of slides today, but I think this one's really important for a couple of reasons. So here, this slide shows specific heat-related deaths among crop workers in the United States from 1992 to 2006. From 1992 to 2006, there were actually 423 worker deaths due to environmental heat. And two things I wanted to share with you regarding this graph. You can see the rate is increasing in each period and much higher in 2002 to 2006. And the second thing was the average annual fatality rate of 0.39 deaths per 100,000 crop workers is actually 20 times higher than US workers overall. So it's drastically higher. And just for your reference, July was the highest month of deaths, and most deaths occurred after 1 p.m. during the day. Here, I just wanted to share some new research that no one else has looked at yet that we've done at University of Illinois, Chicago. Here, I'm presenting percentage change in acute traumatic work-related injuries for two separate patterns of temperatures. We're looking at on days with increasing temperatures above 76 degrees Fahrenheit, and then we're also looking at extreme heat days, which is daily temperatures greater than the 95th percentile of temperatures per month per region in Illinois. So this data comes from hospital data in Illinois for the state. We looked at all workers 16 years and older reporting a work injury, presenting to hospital with an emergent presentation of an acute injury. So here I'm looking at injuries, not heat-related illnesses, but I wanted to look at how temperature and heat impacts injuries. And over the years 2017 to 2022, we actually had 92,000 workers present with acute injuries. And here, this first graph shows the changes in acute injury presentations, and you can see here some of the issues we talked about with seasonal farm workers not being able to access appropriate health care, appropriate workers' compensation, because you can see the drastic difference in the decrease in Hispanic numbers of injuries on extreme heat days versus the stark increases in white, non-Hispanic, male, and African-American workers. For the same project, I just wanted to share based on age and sex. You can see the biggest increases on extreme heat days in acute injuries was in males, particularly middle-aged males, 35 to 54. And 35 to 54 was actually the largest increase. You can see the biggest increase on days above 76 degrees and increasing temperatures was actually in young workers as well, and particularly young female workers. The same data again, we looked at the mechanism of injury, on the type of injury, excuse me, and you can actually see the biggest change on extreme heat days was in traumatic brain injuries, which kind of makes sense when you think about it. These extreme heat days, we're going to get extremely dehydrated, we're at risk of falling. Falls can result in traumatic brain injuries. We're susceptible to heat syncope, which can also result in traumatic brain injuries. And then minor injuries like open wounds and superficial contusions seem to be much higher on extreme heat days as well. The decrease in crush injuries may be related to certain types of work not being done on extreme heat days, such as construction work and other work that typically results in crush injuries in Illinois. And lastly, related to this project, I just wanted to share some of the causes of injuries and how they changed on extreme heat days in Illinois. I would ignore the electrocution data because the numbers are so low that the confidence intervals are so wide that makes it difficult to interpret. But the other causes are actually quite narrow confidence intervals, and you can see cut pierce injuries much higher on extreme heat days, 12.5% higher admissions, presentations to hospital, on extreme heat days, which also makes sense, right? We're more prone to injuring ourselves when we're tired, we're lethargic, we're fatigued. We're more prone to cutting ourselves at work. And like I mentioned earlier with the traumatic brain injuries, it appears that fall injuries occur at a much higher percentage on extreme heat days as well. So that's all the research I'm going to share with you. I'm just going to try and finish this talk on some prevention points going forward. And here I'm going to start with sharing the revision of the OSHA Act from 1987 and just make a couple of key points. So in 1987, they revised the Act to include minimum field sanitation standards for covering agricultural settings. And 3 points I wanted to highlight are sort of color-coded on this slide here. So they say covered agricultural employers must provide potable drinking water. However, if you look at the definitions, covered employers equals 11 or more workers on any one day during the previous 12 months. And we know that many work employers hiring under 11 people can get around this, or people can be employed temporarily to get around this definition. The next definition was employers. So employer, the employer who is paying the farm workers, essentially the large agricultural corporations often protect themselves from this definition from liability by hiring independent contractors. So this wording can be misinterpreted as well. And the last thing I wanted to mention about this sentence here was readily accessible. So they need to provide potable drinking water that's readily accessible. However, readily accessible does not specify what it means in terms of distance from the workers for the water to be accessible. And again, we see in the death reports that the water was actually not accessible, but the definition is so vague. I thought I'd quickly share Washington State's outdoor heat exposure rule that came in 2008, because this is the 2008 version on this slide, but it was actually just recently updated in 2023. So I thought I'd share some of the updates with you so you can compare to the 2008 rule. So now in the 2023 update, the rules actually apply to all outdoor workers year round. So it's not just from May to September. The outdoor temperature action levels have actually been reduced in Washington State from 89 degrees Fahrenheit to 52 degrees Fahrenheit for employees wearing non-breathable clothing and 80 degrees Fahrenheit for all other clothing. They've also now included that employers must acclimatize all employees, not acclimatize to the heat, by closely observing them for 14 days. And they've put in various caveats around acclimatization. I think we're starting to realize how important acclimatization is. They've added things around risk factors in workers, personal factors related to heat, such as age, medications, physical fitness, and pregnancy. And they've also included a standard around outdoor heat exposures safety programs that must be included with employers' written accident prevention programs. So these are some of the things that they've changed. I think these improvements are good. I still think there's a long way to go, but it's a good standard to go through. So now let's just summarize some of the barriers that I've talked about today. Firstly, that our federal OSHA does not have a heat standard. Secondly, independent contractors are often responsible for abiding to the regulations, but they're also paid for how much their crews pick. Thirdly, immigration status is often used as a threat, like Yuan pointed out in that article at the start of the talk, to dissuade farm workers from defending their rights. This really reduces any power they have. Fourthly, farm workers are paid by how much they pick. So if water is a 30-minute round trip walk from where they are working, many will choose not to get water. Fifth, bathrooms are often a long way away for farm workers, often a quarter of a mile away. And lastly, the field sanitation regulation that we just talked about does not specify how close drinking water is required to be to workers, and farms with 11 or fewer employees are exempt from it. In terms of prevention principles, I just wanted to highlight my thoughts on prevention principles. It's all about written and verbal instructions and rigorous safety programs that I preach, particularly with the Australian companies I work with. It's about easy access to shade and water. We talk about this again and again, that it's not obstructed or avoided due to precarious working conditions. It's about education and teaching awareness to employers and employees and all the stakeholders involved in farm workers. And it's also about identifying risk factors and just stop treating all farm workers as this homogenous group based on risk for heat-related illness. And on this factor, acclimatization is really key as well. On those points around heat illness prevention, just wanted to share some results from a survey done on 300 Latino farm workers in 3 different countries, where they found that farm workers actually were using prevention methods of drinking more water and resting in shaded areas, but they were not using administrative controls that we recommend, such as changing work hours, changing work activities, all the factors that are typically controlled by the employer. One of the last points I wanted to make was around hydration. We talk a lot about hydration and drinking more. I just wanted to share that many studies have shown that the thirst reflex for workers is not an adequate stimulus for replacement during work. We really need to, as employers and as other stakeholders in health and safety, encourage fluid intake. We need to encourage about 200 to 250 mils every 15 minutes in hot conditions for workers. And I also encourage workers, it's really preferable to have water. I have a lot of workers who tell me they drink a Monster drink or a caffeinated drink at the start of the shift. And if you have a normal diet and you're not working prolonged shifts, really water is the best thing. There's no need for sports drinks in most instances. And you're actually just making your kidneys work harder with some of these other drinks. And caffeine and alcohol can actually dehydrate you a lot further. And we need to preach that to farm workers as well. Again, charts like these are really important for prevention with workers, and just ensuring that they know to take a look, notice if they have dark yellow urine, and ensuring they know that their urine should be the color of numbers 1, 2, and 3 here. And that's all I'll say, but it's a good prevention tool as well. I think heat acclimatization we probably talked about enough today. I just wanted to highlight that it's one of the biggest issues, and I think it's really important as a doctor and epidemiologist, you see that deaths occur much higher in new workers, in young workers, and we really need a standard so that people actually adhere to acclimatization protocols and programs so that workers are not dying on their first week on the job. That should never happen. I think shade and rest we've talked about a lot today as well. And I think this is self-explanatory, but again, if we do a standard, it needs to be cemented in clear definitions that can't get around, that really do provide workers with appropriate shade and rest. In terms of personal risk factors, these are some of the risk factors for workers becoming more susceptible to heat-related illness. I won't go into these into too much detail. I think we've talked about a lot of them. The only thing I'll probably mention is that in terms of age groups, a lot of the data has shown that there's kind of a bimodal distribution where we're seeing a lot of injuries and illnesses and deaths in young workers in the 20 to 40 age group. And then we also see a peak in older workers, 60 plus age group as well, because of comorbidities and various other physiological changes in older workers. So it's really important to understand there's different prevention methods and different issues in different age groups of workers. In terms of medications, I think I won't go into this too much detail, but I just wanted to note that, again, it's just important to understand what medications workers are on. This changes workers' profiles of risk for heat-related illness drastically. And just to share, in one study, they found that nearly a third of heat-related deaths took medications actually associated with heat-related illness. So it is a very important topic that we need to start discussing as well. Again, that same study that looked at the survey with 300 farm workers, a point I just wanted to make was the biggest thing that farm workers lacked was knowledge around acclimatization. 44% of farm workers surveyed thought that you acclimatize within 2 hours of working a new job, when it actually takes around 7 days, 7 to 14 days. So again, acclimatization and education around that is really important. Lastly, I just wanted to share with you some results from a Texas heat stress awareness program. Again, this is a small study, but it just shows what we might look to do in the future and how I keep sharing that we need to treat farm workers as not a homogenous group and based on their risk profiles. So this heat stress awareness program in Texas broke workers up into 4 groups based on risk factors. Typically, those risk factors that I just highlighted on the previous slides around age, comorbidities, medications, prior work, and various other risk factors. And then they got each of these protocols based on the number of risk factors they had, which I think is really smart, and it's a really important thing to do in the future for at-risk occupations. And what was interesting about this Texas program was that they found their workers' compensation costs went down 50% per heat-related illness. And workers who had heat-related illness during the program had 2 or more of the identified risk factors, so they're in the high-risk group. And the total number of heat-related illness cases decreased. Again, this is a small study, and I know there'll be issues with doing something similar with farm workers, but it just gets us thinking about different risk profiles, and thinking about farm workers individually and not just as a group. And this is my last slide. Thank you for staying on for so long. In summary, I just wanted to summarize everything from today in 4 points. I think firstly that heat-related illness will occur in the workplace. It'll occur in farm workers. It will continue to occur. And it's really the Swiss cheese model where there'll be a day where everything that could go wrong does go wrong. And we have to have the protocols to manage accordingly already in place. And right now we do not have those protocols in place. The points around the death records, where colleagues not identifying signs and workers not identifying signs in themselves. I just want you to remember the signs we talked about today: the skin, the nausea and vomiting, the signs in the gut, and the mental state. And we just need to reiterate workers to ask the questions: how much have you had to drink today? How dark is your urine? How are you feeling? And just think heat exhaustion, think heat-related illness when it doesn't make sense. Thirdly, I just wanted to remember the 5 prevention principles, instructions to the workers: encourage hydration, raise awareness, and really take care of your mates that are at risk of heat-related illness, and have processes in place for new and returning workers. I think screening and acclimatization is going to be really important in the future if we're going to reduce the morbidity and mortality in this area. And lastly, I think this is a really important point as well. I think everything I said today is meaningless if it is not underpinned by a good, strong workplace culture and good communication between workers. If workers don't speak up and workers don't look out for each other, all the prevention efforts we have talked about are really meaningless. So we really need to underpin everything by good culture and encourage communication with workers. And lastly, I want to thank you for joining today. I want to acknowledge my colleagues, Linda Forst and Alana Grossman, for their work in this area and their work in helping get this talk together. This work that we do at the University of Illinois Chicago is supported by a US NIOSH grant. And we work as part of the Great Lakes Center for Farm Worker Health and Wellbeing in Chicago, which is a part of a network of centers for agricultural safety and health funded by NIOSH. The center is comprised of a number of academics and service providers in this area from multiple disciplines, and really recognizes the importance of hired migrant and seasonal farm workers in sustaining agriculture. This is such an important occupational group, and we really need to take care of them in the Midwest. And I think that's all from me, and I'll hand over to our chair, and thank you for having me today.
Thank you very much, Dr. Brett. I'd like to thank the Farm Doc sponsors who've continued to make this and this whole series occur and happen. You can go to the next slide. And also thank our educational partners who help us with getting all this set up and recorded and so on. Next slide. And again, thank you for joining us. We have about 5 minutes left for Q&A. If anybody has any questions, please put them through the webinar. Would love to answer these questions. And I'm going to start first. Dr. Brett, in one of your slides and presentations, you shared and the difference between my mind is blanking out, heat exhaustion and heat stress, and one of a heat stroke. And he said one of them you should give them water, and another one you should not give them any drinks. Do you know why would that be the case?
If heat stroke, you can still give drinks. Typically, heat stroke, there's going to be collapse, but and if you're forcing drinking down someone who's collapsed, heat exhaustion, they still maintain perfusion of the brain, and they still maintain consciousness, and they can still understand instructions and drink. Heat stroke is really the worst of the worst. So heat stroke, you typically have a worker collapsed, they're not sweating, their temperature is through the roof, and we need to cool them down as quick as possible, and immerse them in whatever we can to cool them and get their clothes off and get them in shade. Once that works, you can start hydration, but typically these are the cases where that will take some time and they will need to go to hospital and get intravenous infusions. So those cases are really, they're not as common as heat exhaustion, but those cases typically priority is just to cool the body down, not force any hydration on the worker as well, because in those instances as well, their organs have already begun to shut down. So it's not going to make much of a difference in terms of trying to hydrate someone who's half conscious at that time. If that answers the question.
Yeah, it does actually. Thank you. I really appreciated that. I think that's all. Thank you everybody for joining us, and we hope to see you next month.